My name is Dr. Jay Patel. I'm the Director of Sports Science with the Motion Analysis and Performance Lab. The Motion Analysis and Performance Lab is a multidisciplinary approach to analyzing movement, whether it's biomechanical, physiological, or central nervous system, peripheral nervous system related. Regardless of what the patient is coming in for, we start looking at the whole body. So we start with the foot and we work our way up to the shoulders, wrists, elbows, hands. The group that collaborates in the Motion Analysis and Performance Lab includes researchers, strength and conditioning professionals, exercise physiologists, athletic trainers, sports dietitians, sports medicine physicians, and physician assistants. One of the unique aspects about the Motion Analysis and Performance Lab is the equipment that's in there is utilized by high-end athletes and professional athletes, but at the same point in time, we use that same equipment for just the general weekend warrior or the 40, 50-year-old who just wants to run and be able to walk with their dog without any pain, or the middle schooler or high schooler who just wants to play and compete.
The MAP Lab is a really fun tool to help gather more information to take care of our patients. It allows us to see at specific time points what your functional abilities are, and then look at a time point in the future and see how much of an improvement you've made.
The MAP Lab is innovative technology. We're the first in the Midlands to bring this. We have numerous examples of patients who are hurt, but we can't find exactly what's wrong with them and can't get them back to their sport. We bring them to the MAP Lab, study their motions. We find muscle groups that might be too weak or too tight. We can get them better and get them back to sports and better performing and eliminate their pain.
The primary unique character of the Motion Analysis and Performance Lab is the variety of clientele patients that we are able to support, whether it's 2 or 3-year-old individual with cerebral palsy or spasticity, learning how to walk, to be able to help support their motor development patterns and use the 3D motion analysis equipment to help determine what type of surgeries they need, up into a 8 or 9-year-old Little League pitcher who just wants to get better, all the way through high school, collegiate level athletes. The results that we typically see with our patients and clients that come in are a reduction in pain, an increase in joint range of motion, an increase in strength, and an overall increase in performance.
My name is Tyrell James. I am a professional wrestler. I've done some stuff with WWE. I ended up working with Dr. Patel because in my hip and lower back, it started to develop a chronic pain. He put me on the treadmill, recorded how I move functionally, how I move when I work out. Through his help, we wind up kind of coming to a consensus of what the issue could have been. And it was about how I was training. Thanks to Dr. Patel and Dr. DeMont, my pain that I thought was chronic is almost completely alleviated. I would totally recommend Dr. Patel's Motion Lab because when he can give you little small detailed corrections on how to do a lift better, how to run a little smarter, or how to just exercise or take care of your body in general a little better, you will prolong your athletic career and your standard of living as you get older, just because you made these small adjustments to what you already know how to do.
One of the things I enjoy the most about working in the lab is the wide variety of patients and athletes and clients that come in through the door. So it's always tough to really determine what they're coming in for, because it could be something that they would never even think about that's causing their knee pain or their hip pain. Being able to put all the pieces together of the puzzle to figure out, what's really the source of the issue, whether it's the type of shoe they wear or the way they're gripping the bar, and then communicating that with the physician and being able to improve the patient's quality of life.
I think the MAP Lab is a great experience for patients. It's a way to have fun while gathering data for your physician, to learn a little bit more about your condition and your physical abilities. And so far, I think our patients have really enjoyed the experience.